Now, one company, as you just heard, that has borne the brunt of the administration's heat in recent days when it comes to health insurance premium increases is WellPoint, the biggest U.S. health insurer by enrollment. And here to respond now is WellPoint's Executive Vice President of Strategy, Brad Fluegel. He's with me here at the museum. Brad, thank you for the time. Appreciate you joining us.
Thank you for having me here.
You've heard the Secretary on several occasions this past week. The President again today in public comments out in Nevada, taking aim at WellPoint, particularly this increase out in California, 39% proposed increase. I'll give you the opportunity to defend it.
Well, I think there's a lot of misinformation about what's ultimately driving health insurance premium increases. The reality is that what's driving health insurance premium increases is the underlying cost of medical care. Health plan profits are relatively modest, less than 4% in our case. If you completely eliminated health plan profits in the entire industry, it would pay for 2 days of U.S. health care expenditures. Somebody else is responsible for the other 363 days. And I think we really need to be focused on what those underlying cost drivers are as opposed to where the insurance premiums are ending up.
You know there are a lot of politics involved in this right now. The Secretary points to a very simple number here, $2.7 billion. That's how much WellPoint made in the fourth quarter. A week later, she says this proposed premium increase was made. How can you reconcile that with the American people, with people out there trying to find out what's right in this debate?
Well, let me deconstruct the financial performance of WellPoint for last year, because I think there's a lot of misinformation about that as well. Though we did have a $2.7 billion earnings in the fourth quarter, over $2.2 billion, $2.3 billion of that was related to the sale of a big asset that we had that had been in the works for a while. Our actual profitability was under $400 million during that time period, so not a huge amount of money. And again, I think the main point here is that insurance company profits are not what are driving these increases. I'd also like to point out that we filed these rates with the insurance department in California last November. The insurance commissioner had an opportunity to review those rates for 30 days. There were no comments on those rates, and we simply moved ahead with implementing rates to ensure that we have adequate financial resources to pay claims of policyholders as those claims come due.
Is this politics? You all are being called to the Hill as well next week for a hearing over on the House side. Are you being unfairly vilified here?
Again, I think there's just a lot of misinformation about what's driving these cost increases. I think that there's a sense that we are unregulated when we're in fact enormously highly regulated across all of the different states that we operate in. In California, there's a requirement that we have to spend at least 70% of our premium dollars on medical costs. We spend well in excess of that. That's been confirmed by an independent third-party actuary who's said that we exceed that requirement. We welcome the commissioner's review in California and expect that his independent actuary is going to come to the same conclusion, that we spend well in excess of what's required to be spent on medical care.
Even though you may disagree on the reasons for the premium increase with the Secretary, do you agree with her conclusion that this is what's facing America if health care reform does not become a reality? Do you all at least agree on that notion?
Well, we've been advocating for over a year and a half now that we need to have some substantial fundamental health care reform. But it needs to address really the two core issues that I think are illustrated by the rate increases that we're experiencing in California and other plans are experiencing across the country. And that is that it needs to be focused on reducing the underlying medical costs. That's what's driving these cost increases, is that those medical costs, costs for hospital services, which are going up by more than 11% in California, for pharmaceutical services, which are going up by more than 13% in California, that's what's driving it. We also need to have reform that ensures that we have a balanced risk pool so that we don't have the issue we have in California and elsewhere, which is that younger and healthier people are dropping out of the risk pool.
In part a reflection of the economy, as I'm sure you and others would argue as well. What about the future going forward? We have this summit coming up here. A lot of people thinking health care reform is dead because of the election results in Massachusetts. And again, the administration has made the case you all are standing in the way. The industry writ large has been standing in the way of an overhaul getting done.
I don't think that's the case at all. We have been at the table and providing information and our ideas and our thoughts about what would make the system work better. We've been doing that for well over a year. Again, we've brought forth a lot of positive suggestions as to what would work. Again, the focus has to fundamentally be on the underlying medical costs. We have to, as a nation, figure out how we're going to better address those underlying costs. We also need to ensure that the insurance markets work appropriately. We have proposed a set of changes to how insurance markets work, which eliminate pre-existing conditions, which allow people to get access to insurance coverage whenever they want. But in order for that to work, we need to ensure that everybody has access to the pool and participates in the pool.
Really quickly, Brad, you know this meeting's taking place at the White House. The chances, from your all's perspective, that a deal gets done, something you can support this year?
Well, we haven't seen what that deal might be. That's been part of the lack of transparency during this whole process. We welcome what the new proposal is, and we'll take a look at it and see if there's some elements in there that would actually help American families.
Brad Fluegel, we appreciate you joining us here on Taking stock. Appreciate it.
Thank you.